You're spending 15.6 hours every week on administrative tasks. That's nearly 2 full clinical days lost to paperwork instead of patient care. Your staff is handling 43 prior authorization requests weekly. That's 12 hours of work that could be spent actually treating patients. And you're trying to hire more help, but 44% of practices say medical assistants are the hardest position to recruit right now. There's a better way. If you're a physician or practice administrator, you know the reality. Your team is drowning in insurance verification, billing follow-up, appointment scheduling, and documentation. Patient portal messages are piling up. 74% of physicians now report feeling overwhelmed by patient communication alone. Meanwhile, you're facing a nationwide shortage of 100,000 healthcare workers by 2028. When you do find candidates, salary expectations have jumped 20% in 5 years. And even if you hire someone, there's no guarantee they'll stay. The administrative burden isn't just frustrating, it's costing you revenue, burning out your providers, and limiting how many patients you can see. A virtual medical assistant is a trained healthcare professional who works remotely to handle your practice's administrative, billing, and documentation tasks. But here's what makes them different from general virtual assistants. They're not customer service reps learning medical terms on the job. Virtual medical assistants come with specialized training in medical terminology, HIPAA compliance, EHR systems like Epic or Cerner, and healthcare workflows specific to your specialty. They work from secure HIPAA-compliant environments and integrate directly into your existing systems. They handle insurance verification before appointments, submit and follow up on claims, manage appointment scheduling, respond to patient inquiries, and document clinical encounters in real time. The key difference from in-house staff? They cost 50 to 70% less. Typically $3,000 to $4,500 monthly for full-time support, compared to $65,000 annually when you factor in salary, benefits, payroll taxes, office space, and equipment for an in-house medical assistant. How it works. Virtual medical assistants don't replace your clinical staff. They complement them by taking over the time-consuming back-office work that's keeping your team from focusing on patient care. Need someone to verify insurance eligibility and handle prior authorizations? A VMA does that remotely while your front desk focuses on patients in the waiting room. Drowning in billing and coding tasks? A VMA, trained in your specialty, submits clean claims, follows up on denials, and posts payments, all without taking up space in your office. Want a medical scribe so you can actually look at patients during appointments instead of your computer screen? Virtual scribes listen in real time and document directly into your EHR. The practices implementing VMAS report seeing 2 to 3 additional patients daily because providers aren't buried in documentation. They're experiencing 15 to 25% reduction in claim denials because billing is handled by specialists. And they're saving over 10 hours weekly on administrative tasks. I know what you're thinking. Is this HIPAA compliant? Yes. Reputable VMA providers maintain HIPAA compliant infrastructure, require business associate agreements, and train all assistants on healthcare privacy regulations. Will they know my EHR system? Most experienced VMAs are trained on leading platforms and receive focused training on your specific system during a 2 to 4 week onboarding period. What about quality? Top providers assign account managers who monitor performance and handle any concerns immediately. If a VMA isn't meeting your standards, they replace them. Virtual medical assistants aren't the future. They're already transforming how successful practices operate. The healthcare virtual assistant market is growing at 30% annually because doctors are discovering they can reduce costs, see more patients, and actually go home on time. If you're spending more time on paperwork than patient care, if you're struggling to hire qualified staff, or if your providers are burning out from administrative burden, it's time to explore virtual medical assistants. Visit virtualmedicalassistant.ai to schedule a free consultation and learn how VMAS can give you back your time and your practice.